Hello, so this is Fundamentals of Case Management Practice, Skills for Human Services, 5th edition. Chapter 15, the first interview. We begin the assessment process. We look at the person's strengths and supports, weaknesses and gaps in support, current problems that cause the person to seek help now, potential problems, a sense of who the person is. Your role in the first interview is to listen and convey an accurate understanding of the client's perceptions about themselves and their problems. This is done using reflective listening. Formulate a professional understanding of what is the client experiencing and what this person will need while being served by your agency. Strive to establish rapport with your clients so that they feel comfortable with you and your agency. The client's understanding. Most people come in recognizing they need help. In a few cases, people do not feel that they need to be there. Often people have trouble describing their problems. People often do not know what services they need or how the agency can help them. People usually do not know all the services available in their communities. Preparing the first interview. Look at the intake material, check past agency records, look at past medical history. Keep in mind the material was collected by others who saw the material under very different circumstances. Make sure your office is a comfortable place in which to confide in another person. Meeting the client. Go out to your waiting room to meet the client. Introduce yourself using your full name. Make a mental note of your first impression of the client. Make a mental note of the client's reaction to you and the situation. Show an interest in what the client has to say. If asked, give your credentials. Point out respectively, if asked personal questions, that the interview is about the client, not about you. Describe the agency and its purpose. Make sure payment arrangements have been explained. Make sure confidentiality limitations and policies have been explained. What to do as clients describe their issues. It is all right to take notes. Note-taking ensures accuracy. Allow people to tell the story in their way. Encourage the person to talk about their issues by using open questions and reflective listening. Examples. So the last 8 months have really been difficult with your mother. Tell me a little more about what's happening with her. Judging and clarifying. Avoid judging clients who may have different values or lifestyles from your own. To seek more clarification, use open questions. Example, can you tell me more about your sister's comments that evening? Refrain from using why questions, which may sound like prying or ask for a level of understanding the client does not have. What information to collect? Seek to understand why the client is here now as opposed to last week or last month. What happened to bring the client in now? Document the client's presenting problem. This is generally what brought the client to the agency. The extent to which the problem has interfered with the client's ability to function. The support system the client has or does not have. What the client is expecting as a result of coming to the agency. Client expectation. Clients or their guardians should participate in the planning. Ask people what it is they would like from your agency. Often they will not know what services are available or what they need. Explore together what treatment or service options there are for the client. What information to collect? Most important, understand why the person is here now. To what extent the problem interfered with functioning? To what extent has the problem interfered with relationships? And does the person have a support system? Client expectation. What does the client want from the agency? What services does the person have in mind? Often people do not know what services are available. Explore what you have to offer with the person. Client obligations. Help clients understand that there are expectations that they will contribute to the success of the relationship. They will need to keep appointments. They will need to cancel in advance. They will need to bring in documents to process payment for services. They will be asked to contribute ideas and concerns to the overall process. 3 tasks for the first interview. Does the client have any questions? Be sure to ask and answer every question thoughtfully. Do you and the client have a mutual understanding of the problem? Work with the client to define the problem in language he or she can understand. to what are the client's expectations. Find out what clients expect as a result of coming to the agency. Wrapping up, ask clients if they have any questions they want to ask you. With the client, define the problem in language they understand. Verify that what the client is expecting. Tell the client what will happen next. Give the client an appointment card if there is a next appointment. Rise at the end of the interview to indicate the interview is complete. Do not allow clients to leave if you think they are considering harming themselves or someone else. After clients leave, do not talk about whether other clients can overhear you. Okay, so that's the end of this video. Thanks for listening.